I'm Dan Rutz with the U.S. Centers for Disease Control and Prevention. The nations of the world are on the verge of winning a global war against polio, which has been with us since the dawn of civilization, but within a very short time can be eliminated once and for all. Little more than 100 years ago, polio mainly brought occasional illness in small clusters. But starting in the 1800s, the outbreaks began to get larger until by the 1950s, polio had erupted into a global epidemic. During this time, hundreds of thousands of children were disabled, many even losing the capacity to breathe, their very lives depending on large devices like this iron lung. CDC and Rotary have a long and proud history of working together to eradicate polio, so that one day soon, no child need ever again be paralyzed or killed by the poliovirus. CDC's director, Dr. Tom Frieden, strongly supports the global effort to eradicate polio.
When Rotary and CDC started this effort, about 1,000 children a day were disabled permanently from polio.
Rotary envisioned eradicating polio by 2005, their 100th anniversary.
The World Health Organization has made it official. Smallpox throughout the world has been virtually eliminated.
After smallpox was eradicated in the 1970s, the global public health community strongly considered the possibility of eradicating polio as well. But polio presented a far greater challenge.
Polio eradication is a lot harder than smallpox eradication. The vast majority of people who have infection with the poliovirus don't have symptoms. So we can't go in and isolate and vaccinate around them, and that was something we could do with smallpox.
The poliovirus is highly infectious. It spreads easily from person to person. Even so, 9 out of 10 people who become infected show no symptoms. Most of those who do become sick have only minor illness, such as fever and other flu-like symptoms. But regardless of symptoms or lack of them, infected people can easily spread the infection. In this way, the virus can spread from person to person across great distances without being detected. Fewer than 1 out of 100 people infected with the poliovirus will become paralyzed, so they cannot move one or more parts of their bodies. These relatively rare but tragic consequences occur when the poliovirus invades the brain and spinal cord, destroying nerve cells. Although polio is more likely to attack the central nervous systems of children, when adults are stricken, the virus is more likely to cause severe permanent paralysis or death. Perhaps polio's most famous patient was Franklin Roosevelt, who was stricken and paralyzed at age 39.
We are making it possible to unite all the forces by starting the work of the new National Foundation for Infantile Paralysis.
While he served as President of the United States, Roosevelt established the National Foundation for Infantile Paralysis, later known as the March of Dimes, which provided much of the funding for the polio research that led to safe and effective vaccines. Jonas Salk invented the injectable Salk polio vaccine, which uses a killed poliovirus to build immunity from polio infection. The Salk vaccine was licensed in 1955. A second polio research pioneer, Albert Sabin, developed an oral vaccine that uses a weakened but live poliovirus. It was approved in 1962. Both vaccines have contributed to the fight against polio, but the cheaper and more practical Sabin vaccine has been most useful in the final push to eradicate polio. These vaccines gave the public health community the tools that would make conquering polio possible. What was still needed was the motivation, the political will to build a sustained global effort.
You noted at the outset that CDC is among a number of partners engaged in this work. Let's talk about one in particular, namely the Rotarians, and how that came about and how they got involved and how we got involved with them.
Rotary has been a terrific leader and partner. They've been one of the spearheaders to establish the Polio Eradication Initiative and to lead it for the past several decades. Rotarians all over the U.S. have not only contributed time and effort and money, but they've met with people who've helped to move polio eradication further along. They've been essential in allowing us at CDC to do the work that we do. And all around the world, Rotarians meet with leaders, with health officers, and with others to push polio eradication and help get us closer and closer to the finish line. We would not be here today without Rotary, and I do not think we will get over the finish line without Rotary.
The genesis of the Global Polio Eradication Initiative actually started with Rotary in 1979 with our first project to immunize children in the Philippines. That evolved over several years to our Polio Plus program, which we launched in 1985, which was a fundraising initiative to raise $100 million. For polio immunization activities. We raised $247 million and unleash an army of volunteers, mostly in South America, to actually go out and immunize children and provide support to volunteers that were immunizing children. Dr. John Sever is the Rotarian that had the idea of getting Rotary involved in polio immunizations. He met one of the Rotary presidents, and that president asked him what might we do after smallpox.
So my recommendation to him was to immunize the children of the world. Rotarians, combining with their governments and with the public health services, could carry on this type of a program as a special, unique program for Rotary. And he accepted that. He took it to the board, Rotary International. The board accepted it then as a program to immunize the children of the world to eliminate polio.
The effort to eradicate polio requires a lot of people and a lot of money. Rotary plays a vital role in financing laboratories, travel, vaccines, and field personnel.
Well, our role depends upon where you live in the Rotary world. Rotary is in over 200 countries and geographical regions, okay? In Canada and the United States and North America and the developed world, it's get money. Get money not only from the Rotarians, but get money from governments.
Rotary itself is one of the major contributors to the global polio eradication effort. We've contributed over $1.2 billion. So not only as an organization do we contribute, but we also advocate to governments for them to allocate resources to global polio eradication initiatives.
This includes championing the U.S. government's and CDC's commitment to polio eradication.
We've been fortunate to be able to go to the U.S. Congress and increase their funding from a few $1 million to over $100 million a year, which has given them the opportunity then to bring on more people to go out and do the work in the field.
Rotary members also raise money from the public and contribute generously themselves. At Steve Zimmerman's Rotary Club, they award a medal to each member who gives $1,000 to polio eradication.
I was the 200th one in my club, which meant that the Marietta Club, when I was awarded one, had already given $200,000 to the eradication of polio, and Rotary clubs all over the world are doing that.
Encouraging government involvement is another key part of Rotary's contribution to polio eradication.
When you get over into countries that are polio endemic, it was the ability to put pressure by the Rotarians on their governments to do something, to participate, to provide the resources.
And then also advocacy in the polio endemic and high-risk countries such that they make polio eradication a priority in their country. We need the political will where polio exists. We are the only organization in the global polio eradication effort that are in the communities all over the world. We're in over 170 countries or 200 geographic areas. We're business leaders. We Rotarians may know personally their government leaders and can advocate on a very personal level with them and are recognized as leaders in their communities. We have some influence with governments because governments want to respond to their constituents.
Many Rotarians have also contributed with their labor, working in the field as part of vaccination teams.
I'm not a physician. I can't go into a country and do surgery and some of those other things that wonderful people with those skills do, but I could go put 2 drops in a child's mouth and I could bring that story back and I could get people excited about making a difference in the lives of these children.
CDC is a partner, a lead partner, helping to guide technically and from a laboratory standpoint the eradication of polio. We've been there since 1988. We'll stay with it until we're over the finish line.
The science of polio eradication can be divided into disease detection and laboratory support. CDC epidemiologists work with partners around the world to help plan out surveillance and vaccination activities. Not only does CDC help with scientific planning, it also trains epidemiologists in other countries to boost and maintain their own public health program. The payoff extends to fighting many diseases, not just polio. CDC demonstrated its laboratory capabilities to Rotary members as part of World Immunization Week in April 2013.
So it's sending out the first plate that's got the sample.
CDC's laboratory system is one of the most powerful weapons in the war on polio. It is the scientific and technical backbone of the larger effort for tracking the virus, finding its hidden pockets of spread, and thereby showing where to concentrate vaccination efforts.
CDC laboratories are reference laboratories for the world. We can do quick testing, but also in-depth genetic testing. But perhaps even more importantly, we help laboratories everywhere in the world upgrade their skills. We work with the World Health Organization and countries so that there's a national and international reference system for polio.
Dr. Olin Q leads CDC's polio laboratory, through which the agency shares its technical expertise worldwide.
There is a global poliovirus network that is 145 labs strategically located all around the world so that no child with polio would not have their case investigated by the epidemiologist and by a laboratory.
CDC has invested substantially to help build this laboratory network. Reliable laboratories in countries that face a steady threat from polio provide the immediate information epidemiologists need to quickly find and contain new outbreaks. In countries like Pakistan, one of only 3 remaining countries with endemic polio, this is especially valuable.
In Pakistan, we train the scientists to use the same technologies that we developed here, so they do their own work now. And there was a period of time, sort of like a passing lane in a relay, where we worked in parallel till we saw that they were working so well that we could easily just accept their results at face value. There's a 3-tier structure, and then specimens come from national laboratories to regional reference laboratories, and from regional reference laboratories to global specialized laboratories like CDC, and samples would come then to us.
Specialized laboratories like those at CDC are equipped to provide detailed genetic analyses.
What piece of the puzzle are you providing here?
We're actually telling them whether the causative agent of the paralysis is caused by poliovirus or something else. And if it's a poliovirus, what type and where it came from. And we can track it to a high level of precision and even date when it was introduced into a particular area.
Give me some ideas, please, of how that information is of practical value in the field, in the eradication effort.
Good question. One of the issues is, where are the reservoirs harboring poliovirus? Another question is, when do we know we've actually finished the job? In the Americas, for example, we know we finished the job because we got no more wild poliovirus in any country in the Americas. That process has been repeated over and over again in many different countries.
Even when polio has been eliminated from an area, it can return from neighboring areas. CDC's polio labs use genetic analysis to track the movement of viruses from one area to another.
And we could watch the virus flowing out of the reservoir communities into the indicator communities.
When imported polio cases indicate the virus has spread, field epidemiologists compare the patterns of spread to the movement of people and send in teams to promptly vaccinate those coming from infectious areas. This allows polio workers to intercept the virus and protect people who have likely been exposed in areas that may be hard to reach because of security concerns or geographic barriers. CDC's polio lab and the global laboratory network it helped build provide the information field workers need to track down the virus. But that is not their only role in polio eradication.
There's other work going on here too, and it sounds like some of it has to do with vaccine development. I guess an outsider might ask, why do we need to focus on that since we have what we think are, I think, fairly effective vaccines already? Why would you be interested in improving or developing new ones?
We have 2 very good vaccines that have carried us this far. First, the inactivated polio vaccine from Salk and Youngner. We also had the oral polio vaccine from Albert Sabin. The Sabin vaccine, the oral poliovirus vaccine, is the one that has been used throughout the world to eradicate polio in developing countries. But the problem with the Sabin vaccine is it's genetically unstable. It changes a little bit, just as the wild virus changes a little bit. And some of those changes can result in the loss of the weakening or attenuation of the virus.
This means that over time, the virus used in the live vaccine can change enough to actually cause polio in some people.
The vaccine virus can spread person to person further than we'd want. The original idea is it might spread to the immediate contact, maybe not much further, and immunize a few children in the community who got missed. But it can go further than that. So what we wanted to do is develop something which would not spread very effectively, but if it did, it would not change its important biological properties. Still be a weakened virus, still protect.
Rotary and CDC, along with UNICEF, the World Health Organization, and the Bill and Melinda Gates Foundation, sponsor the program that trains polio field workers.
The Stop Transmission of Polio program, or STOP, is making a huge difference. Volunteers from all over the world are going to work in difficult and sometimes dangerous environments to help get over the finish line in polio eradication.
These volunteers receive only a modest stipend for their work, but take great risks from diseases, dangerous environments, poor infrastructure, and security concerns. To protect them from security threats, we cannot show the faces of current field workers, but we interviewed one veteran stop worker to find out what it's like to work in countries where polio remains a threat.
What's your impression about how things are going in those places?
Well, they're trying to do their best. Everybody's committed to polio eradication, but sometimes they lack resources, they lack materials, logistics, but I think the commitment is there.
This is not easy work, is it?
It's not.
What are some of the things that make it so challenging?
To stoppers, going to work in the places where you've never been naturally expose you to some stressors and challenges, of course. And security is one of the challenge. You cannot go everywhere you were supposed to go because of the security reason. Many countries are undergoing unrest, rebellions, wars. So insecurity is one of the challenge.
Polio field workers face all these hardships just to place a few polio drops into the mouths of children. While most parents welcome them, some resist out of distrust toward outsiders, ignorance about polio and the preventive vaccine, or sometimes intentionally distorted messages from people who encourage parents to say no to vaccinators.
Other challenges are cultural, languages, food, people, religion. They're not all the same that where you come from.
Security concerns have kept vaccination teams out of a few areas where pockets of polio remain. Some field workers have been killed or injured while performing their duties. The workers who press forward despite these dangers are heroes to Rotary, CDC, and all who look forward to the eradication of polio.
The last mile is always the hardest mile, and we're at the last mile now. I'm confident we can get there, but it's going to take effort. One of the biggest challenges is the lack of security in places where polio continues to circulate and to paralyze children.
CDC and Rotary recognize the dangers field workers face and honor the sacrifices they have made to bring the world within reach of polio eradication. With so much having been given by so many, the goal to eradicate polio becomes all the more important, even when it seems as though the final mile may be the hardest mile.
Don't get discouraged. Don't get discouraged. We can do it. I know it's taking longer. It's taking longer than we ever thought. But the goal of success is so close, and the advantages of having that, so what it will lead to in the future with other diseases, with other cooperations between our, maybe even to peace in many parts of the world. We just can't fail.
We can't abandon now. We need to do more than before, more than ever. Becoming more aggressive than before, because we're getting there soon.
We've come so far. We've gone far too far to turn back. We're close to getting over the finish line, and in this last mile, not only will we protect kids, but we'll also strengthen systems so that other immunization programs, other public health programs, other social programs have a greater possibility of succeeding.
I'm proud because maybe one day we'll be part of this community of heroes who made it possible.
Is there a role for Rotary and CDC in future work, do you think?
We value our partnership with Rotary tremendously. It's been enormously productive. It's been synergistic in the true sense of the term. Right now, we're totally focused on getting over the finish line for polio eradication. When we do that, we'll be able to consider other options in health and social development, immunizations, and other diseases or conditions. But what we know is success breeds success. You go from strength to strength. As we get over the finish line, we can take on huge challenges together and do even more together.
Two of our areas of focus are maternal and child health and disease prevention and treatment. There's many opportunities, and there's to work with the CDC in those particular areas as well. I mean, they have a lot of expertise, and we've got a lot of community presence, so I'm sure there's an opportunity in the future to work together on those areas.
So I see us continuing to set new objectives. There are many other diseases that we can attack.
To Rotarians in this country and all over the world who've been working for polio eradication either for a week or for a decade, thank you. Thank you so much, not only on behalf of CDC, but even more importantly, thank you on behalf of the children who are not getting polio and who will never get polio.
No more polio!
No more polio!
No more polio!
No more polio!
Bye-bye polio!
Bye-bye polio!
Bye-bye polio!
Bye-bye polio!